Hi everyone, it's Dr. Vanessa here with Brio Integrative Health, and thanks for joining me today on this episode of our Facebook Live. Today I'll be talking about a holistic approach to oral health. I'll be going into detail about two disorders of the mouth: bruxism, which is teeth grinding or clenching, and TMJ syndrome. I'll also spend a little bit of time discussing receding gums, which is connected to the other two conditions. If I had more time, I'd also want to talk about natural ways of treating bad breath or halitosis. And something I like to do in my free time personally is compare how well conventional and natural oral hygiene products work. So please comment or let me know if that would interest you at all, and I can definitely present on that in the future. And I've also been dying to try a couple of samples of products I picked up from a trade show from a company based out of New Zealand. And just have them right here. And I have no affiliation with them. I'm not getting any kickback for talking about their product. It just was something that I've never seen before and was really intrigued by. And what they offer is oral probiotics. So I have their throat guard here, which is supposed to help prevent infections leading to sore throats. So things like tonsillitis, and it also may reduce the frequency of upper respiratory tract infections. And I know that's a concern on everyone's mind these days. And the second one for teeth and gums is to prevent gingivitis and plaque buildup. So we already know that probiotics are really important for our gut, for our immune health, so on and so forth, but taking them with a focus on keeping the effect more locally up top at the beginning of our digestive tract. That's a new concept to me. So I am a naturopathic doctor by training, and someone who might be better equipped than me to discuss a holistic approach to oral health would be a biological or holistic or natural dentist. These are all different names that these oral health professionals go by. They're basically the naturopathic doctors of the dentistry world, if you haven't come across them before. So they are really specializing on the link between oral health and whole body health and well-being. Specifically, the mouth-body relationship and mercury safe dentistry, not necessarily mercury free, but to make mercury safer. Oral bacteria have been found to occur in as far-flung places in our body as the brain, and I guess that's not too far, but it's surprising the ways and places that they come up. It's been associated with periodontal disease and other conditions like cardiovascular disease, cancer, rheumatoid arthritis, kidney disease, and PCOS. So if you have any of those conditions and unhealthy gums or gingivitis or chronic oral problems, the connection might not be so random. So the mission of biological dentists is really to lighten the toxic load or the infectious burden in our bodies. I'm currently doing a 10-day detox. It's day 3 now. If anyone in the group is watching, keep up the great work. So they want to detoxify by considering what we're putting into our mouths. Diet is a huge part of the toxic load, something that we can really influence compared to things that are in our environment. And biological dentists also recognize our body's innate ability to heal itself with proper function and structure intact. And they treat symptoms and help identify root causes of disease and discomfort, including emotions. Now, this sounds really similar to the naturopathic principles I learned in school. Another thing, another view of oral health and the different connections to various organs and tissues and glands throughout the body is through traditional Chinese medicine. Of each of the possible 32 teeth in the adult mouth, each one is related to a specific acupuncture meridian, connecting to a path of different organs, tissues, and glands. Issues that occur along one point can affect distal points on the same meridian. So for example, tooth number 7. This is one of the lateral incisors. So on the top row, just on the side of the front 2 teeth. And that's on the right side. So this one right here. If you have nagging problems with that tooth, then you may also see issues come up in the kidneys, the pineal gland, which is associated with sleep and the secretion of melatonin, the base of the spine, the coccyx and the sacrum specifically, and even the feet, and vice versa. If any of those internal structures are compromised, then the corresponding tooth, in this case, tooth number 7, may be more problematic as well. A really important part of our mouth is our jaw. It's what allows it to open and close so that we can speak, so that we can do mouth breathing, so that we can break down and enjoy the taste of our food, and much more. With an energetic view of the body, as with integrative body psychotherapy, the mouth is the aspect which has the most and earliest contact with the world. So what I'm referring to is babies latching on to their mom's breast to feed. And also toddlers' tendencies to put just about anything through the taste test and explore it with their mouth. My mom told me that I used to bite people when I was going through the pain of teething. And some of you may relate to that as parents or remembering hearing stories of you doing a similar response. It's no longer appropriate to bite people when they're upset or in pain. We tend to keep people at arm's length. We're a lot more comfortable with having that personal space. But if someone were to invade our boundary, we may still bite them in self-defense as a last resort. The mouth is not just the machinery for breaking down and tasting food, although that is a top function. Besides nourishment, its other functions also include expression, aggression, respiration, and sexuality. What does a stiff upper lip, a quivering lip, A jutting out chin. I think of pride when someone juts out their chin. Gritting, sucking, or kissing teeth. What do all of those facial expressions and types of body language tell us about how the person is feeling? Some of these things even have a cultural association. With such a wide array of functions and with such early connection to the outside world, the mouth is indeed a very vulnerable area where an energetic release occurs. When an energetic release occurs here, it can release a flood of emotions as well. The jaw, is an area where we can really hold on to things. It's often associated with and can contain repressed anger and a sense of maintaining control. Based on Pearl's theory of dental aggression, which postulates that teething interrupts the pleasurable and carefree activity of breastfeeding. So the infant must withhold his or her aggression and avoid biting their mother in order to continue receiving nourishment from her. This suppression of emotion can cause frustration and even rage with a young infant. Fast forward to adulthood. Someone who is maybe developmentally stuck in this emotional stage of sucking or suckling may not be able to process ideas or properly chew on them, food for thought, and end up swallowing ideas whole and be kind of stuck in their ways. So I've done a lot of talking now, and so I'd like to move on to some gentle movement together to see if we can loosen some of the tension around our mouth and jaw that may have been there since our very early days on the planet. And we're going to do this by exaggerating normal movements that stimulate expression. So now, if you'll join me, what we're going to do is we're going to run our tongues along the inside of our mouths and push against our gums. And you really want to spend extra time where there's more feeling of tightness or tenderness. You ready to practice? And I'm really exposing myself out here. It's not the most beautiful presentation I'm going to be giving today, but I'm going to just let that go. It's a teaching opportunity. Okay, so what we're going to do is use our tongue and massage. That was quite tiring. I don't know about you, but I really had to work to loosen, especially the areas around my cheek. And that's going to come as no surprise when we talk later about the TMJ. I also know that if I were to repeat this exercise, once all the tension starts decreasing, I'm still feeling a little sore from that right now. So a reminder, if it's your first time, to be gentle. It's easy enough to do, but the effects are actually quite pronounced. So if I were to do this again at the end of the talk, I would really notice that the whole area is much more relaxed and looser. Another way to open up the facial muscles is lion's breath. For those of you who do yoga, this may come as second nature, but I'll walk everyone through it. So you're going to be breathing in through your nose, and as you exhale and breathe out, you're going to look up with your eyes and stick out your tongue and let out a big throaty sigh. You can also do cactus arms to further bring the energy up. We'll just do the basic one first. So again, that's breathing in through the nose and letting it hang out by sticking out your tongue and glancing up with your eyes. Let's do 3. I'm going to bring in the arms now. Move back. In integrative body psychotherapy, we do a variation on that called lion's breath, but it's more of a scary lion's breath. So in this, you're really kind of taking up space and telling someone what your territory is and staking your ground. So by doing these lion's breath or the scary lion, what we aim to do is relieve tension and stretch, or relieve tension and stress, and stretch out our whole face. It activates the jaw and the tongue. So the scary lion goes something like this. It's fierce. It's hard to see my reflection while I'm doing this. I'm holding back a little bit for your sake. And when we do it in IBP, we're actually breathing in and out through our mouth. I just was in the old habit of yoga breath for a moment there. Why this breath is important also is because it's a form of a power pose. The lion is the king of the jungle. And as we know from a popular TED Talk, taking these so-called power stances can really have a direct and almost immediate effect on boosting confidence and feelings of powerfulness. In this TED Talk, it was saying that our body language affects our minds and therefore our actions. And from there, our body language actually affects who you are and what you're possible to become. So if you're ever feeling low on energy, or like you're really contracted and your face is barely showing anything and you want to bring aliveness to it, consider the lion's breath. A more direct approach to loosening these muscles here, there's 4 main muscles that control the jaw, and that's the lateral and medial pterygoids, the temporalis, and the masseter. Those are also known as the muscles of mastication. That's what we use in concert to break down food. So what some people will do, and I have certainly put on a glove hand and done a self-release on myself or a patient before, by directly going into the back of the mouth and massaging the TMJ joint from the inside. And massaging through stripping and stroking that fibrous gummy area. The only downside to that is that we now know it's a very vulnerable area, and it may unlock something that the patient is not ready for. So by putting the reins in your hand, you can do as much of the tongue sweeping or the lion's breath as you feel comfortable with, and go at your own pace. So I've mentioned bruxism before, and again, this is the medical term for grinding or clenching. It's often worsened or even caused by stress or teeth misalignment. It may even occur unnoticed because a lot of us do this in our sleep. The only sign might be, and this is how I've experienced it, is clicking or popping the next morning when I'm enjoying my breakfast. So the issue with bruxism is that it can damage our enamel and also cause dysfunction in the temporal mandibular joint, also known as the TMJ joint. The TMJ is actually a couple of bones, and so that's the temporal bone here and the mandible, and between it is a fibrocartilaginous disc, and that's really the shock pad that takes all the pressure when we're chewing and grinding. A quick assessment for how this joint is functioning is simply opening and closing your jaw a few times. You'll actually place the pads of 2 fingers, your index and your middle, just above the lobe of your ear, in front of your tragus. So this is your tragus. It's a popular area to get piercings these days. So you're going to put your fingers right there. Okay, and then just open and close. And now if you look closely at mine, you'll see that my right side, this one, it activates or fires first, and my jaw deviates to the left. I'm trying to square myself so that it's more noticeable. Another way to assess jaw function is through the 3-knuckle test. So you'll insert 3 clean knuckles and bite down with your incisors. So that's the foremost middle teeth in the front. If there's a lot of pain or you're unable to fit at least 3 knuckles in your mouth, that's a positive test. It's a sign that there is some sort of TMJ dysfunction or permanent contracture. That's shortening of the jaw closing muscles, primarily the temporalis, which is a fan-shaped muscle right here, and the masseters. So those range from your cheekbone all the way down to the angle of your jaw. These are masseters. Chronic clenching or grinding can lead to things like tension headaches. You'll know because these start at the temples, can cause pain in the facial muscles. If any of those were really tight when we were doing lion's breath, it might be because you have been clenching unwittingly in your sleep. It even can refer to areas connected to our jaw. So that's our forehead, at the back of our neck, and our shoulders. And the last thing we want, which can happen, is that bruxism can cause fractures in the teeth, and with enough pressure even lead to damage that would necessitate removal of teeth or teeth loss. So I mentioned that popping or clicking sounds are another sign of TMJ dysfunction. You may have noticed that after being at the dentist and having your jaw protracted or open for a long period of time, that some things feel a little bit out of place as well. Whenever we have the opportunity to control the movement of the jaw, so when we're eating and yawning, we should try to do so. So really big apples, chop it up into more manageable pieces so you don't have to overly unhinge your jaw. And also when we're yawning, it's helpful to place a fist under your chin to support it and gently press up to keep your mouth from opening too wide. So when we're yawning, just going like that so it doesn't get out of control. Another exercise to fix any tracking issues that you have, so if the path of your TMJ opening, closing is not straight up and down, is you want to do this seated so that you can fully concentrate. In front of a mirror is you'll take your tongue and put it just behind your front teeth. And there you'll feel, if you reach up, your hard palate. And if you keep on dragging your tongue back, you'll eventually be in the territory of the soft palate, and that's where you want to stay. So once you find your soft palate, this is all done with your mouth closed, you'll slowly open your mouth. And the role of the mirror is to allow us to see if we're opening straight. It's a very slow, controlled, and precise movement. And you'll want to hold it for 5 seconds before relaxing for another 5, and then repeat this a few times. And you can always use the pads of your fingers, again, just in front of the tragus, to help you see the movement. So I didn't do it for the full 5 seconds there, but what I noticed is a tendency for our tongue to break contact with the soft palate. So you should try to maintain contact the whole time. It's not about speed, it's about accuracy. And the last condition I wanted to talk about is gum recession. Now, bruxism, the grinding, clenching, can also contribute to this issue, as well as jaw injury and arthritis. So the reason that gums recede, we might be thinking that, oh, I've been brushing too hard, but that's just a small piece of the puzzle. The gums are just the skin of our teeth, and they bridge our upper and lower jaw. They close off the space between our teeth and our jawbone. And as long as the underlying structure, that's the jaw itself, stay strong and mineralized, there's no reason for the gum to destabilize. So it goes without mentioning that oral hygiene is really important, regular brushing and flossing, because if you don't, that can lead to gum inflammation or gingivitis. Also, brushing with your non-dominant hand, so that'd be my left hand, not only is gentler on your gums, but it also helps strengthen and create new neuronal connections in your brain as you do it. There's also been a what do I call this? The connection between coenzyme Q10, that's ubiquinol deficiency, and in gingivitis. CoQ10 is made by our own bodies in our liver, but it's also available through food and supplements as well. Oral supplements, as well as topical ones. There's some toothpaste that you can get with CoQ10 as an ingredient, has been shown to decrease inflammation and the pocket depth of our gum lines. So gingivitis or the gum inflammation can lead to periodontitis. So that's when it gets to the deeper level of the bone. But it's not just the bacteria itself that's causing inflammation and the damage. It's actually an inappropriate host response to the bacteria itself. While our immune system tries to attack the bacteria and get rid of it, it's also attacking our own gum tissue. And this disrupts the balance between different digestive enzymes, reactive oxygen species, and the things that balance them out. So enzyme inhibitors and antioxidants. So in summary, the things that can cause gum recession are gum disease, gingivitis, trauma. This can be an acute blow to the jaw or something chronic like bruxism, and also genetics. And it's not a lost cause. Remineralization can occur if the overall structure, the bone below, is intact and it's caught early enough. So before I end, I'm just going to quickly go through 3 products that I have to share that can help with the remineralization process. The first one is this Remin toothpaste, and it contains hydroxyapatite. This is the main substance of our teeth. It makes up the majority of our enamel and dentin, and it's a crystallized form of calcium phosphate. This nanohydroxyapatite is almost identical to our own teeth structure, but because of its fine particle size, it helps get absorbed and restore our saliva. So our saliva is actually the natural source of calcium and phosphate for our teeth because it's on the outside. Instead of being nourished by blood, it's being nourished by the saliva. Next, this has been repackaged, but it's just a remineralization solution by Uncle Harry's, and it's a mix of essential oils and a mineral mixture. Oh, here we go. Alkalizing ionic minerals from ancient seabed, sounds fancy, sea salt, and essential oils. It's also a great tool to freshen your breath after eating if you can't brush. And also natural toothpaste. This is from Nelson, BC. They happen to be called Nelson's Natural. And it's similar to conventional toothpaste. It's fluoride free, and instead it has a trace mineral concentrate. So these important trace minerals are calcium, magnesium, and phosphate. So this has been a longer session. I'm really passionate actually about oral health. Before considering pursuing a career as a naturopath, at one point I wanted to be a dentist. And so I could go on and on the topic. So as I said before, if you do have interest in me doing a bit of a comparison between natural and conventional oral hygiene products, and also want to know some natural ways to control bad breath, please leave a comment and let me know, and I would be happy to do that. And don't forget to practice those exercises that I taught you. So that is loosening the inside of the mouth with the tongue, the lion's breath, the controlling the yawns with a fist, and also practicing by touching the top of the soft palate with your tongue and slowly opening and closing your mouth to correct any mistracking issues in the TMJ. Thanks for joining me. It's Dr. Vanessa, and I hope you have a great rest of your day.